Community COVID-19 infections in Singapore hit a 9-month high. Half the cases are linked to a nurse at Tan Tock Seng Hospital. No visitors are allowed at the hospital wards for now. Joining us with more tonight is Professor Paul Tambyah. He's president of Asia Pacific Society of Clinical Microbiology. Good evening, Professor Tambyah. Singapore reports 16 community cases today. That's the highest in more than 9 months. Should we be concerned?
Well, I think we should be a little bit concerned, but not paranoid. On the one hand, it's good that these cases were identified and the detailed investigation has begun. But on the other hand, I have to admit it's disappointing, as I'd hoped that, with the massive vaccine rollout, that we'd get back to normal soon, like what's happening in places like Israel, the UK, US, and UAE.
Well, among them are 8 cases linked to a fully vaccinated nurse at Tan Tock Seng Hospital. How significant is this development in Singapore's fight against the pandemic?
Well, we don't know who exactly was the index case in the Tan Tock Seng cluster, whether it was the nurse, whether it was a patient, whether it was a family contact, or some other individual. I'm pretty sure that the poor epi teams are working overnight, trying to piece together all the details from the molecular fingerprinting of the viruses to linking all the data points from contact tracing, PCR, and serology testing. Now, the interesting thing is, unlike the original SARS, hospital clusters have been relatively rare globally, except in nursing homes. So it would be unusual if this became a large cluster. The Tan Tock Seng and MOH leadership have already taken steps to control the spread, and we hope that these things will work. Key is understanding how the virus got in and using all the tools we have to determine how it spread to prevent it from spreading further.
Professor Tambyah, as of Wednesday night, Singapore has at least 6 open clusters that have emerged since mid-April, following around 3 weeks of 0 clusters. So what are the possible reasons for the spike, and what more can we do to prevent further infections?
Well, there's been a global resurgence of cases, especially in Asia, like what's happening in India and Thailand and Japan, with a few notable exceptions, like, for example, the highly vaccinated settings, like I mentioned, in the US, UK, UAE, and Israel. As such, given that Singapore is one of the world's most highly connected cities, it's not surprising that, we've had cases leaking through. I think it was a bit over-optimistic to think that we could live in a bubble forever and still keep our trade-dependent economy going. The key, though, has to be thorough investigation of each case and cluster, like what we did in March 2020.
Well, similar to the nurse, there's also been recent numbers of vaccinated people getting infected. Help us understand how that works, and are they at risk of succumbing again to COVID-19?
Well, I think it is a bit of a cause for concern that we've got vaccinated people getting infected because, the data from elsewhere and the clinical trials suggest that the current vaccines that we have in Singapore, the Pfizer and Moderna vaccines, are 95% effective. So if this was just a normal 5% failure rate, then that means for every person who's found to be infected, there are 19 other people who would have been exposed and potentially infected, which is quite a lot. What I'm more concerned about, though, is whether there's some kind of cold chain failure, and there needs to be a very careful scrutiny of all the transport and storage logs to ensure that there was no cold chain failure, especially as, these mRNA vaccines are very sensitive to heat. So what we need to control the outbreak is effective vaccines. And I'm sure the authorities will check on the temperature and handling logs for all the batches of vaccines concerned to make sure that everything was okay. I'm still a believer that, vaccines are going to contain this outbreak and we'll get back to normal soon.
Well, thank you very much for your thoughts this evening and for your optimism as well. Professor Paul Tambyah, President, Asia Pacific Society for Clinical Microbiology.